And our first speaker is Dong-Soo Kwon, who's an emeritus professor of mechanical engineering at KAIST in South Korea, and he's also the CEO of Ruan Surgical. Dong-Soo, take it away.
Okay. Good morning. It's very challenging to have a speech right after there was a big party. Today, I'm going to share my experience from research to commercialization with the robotic ureteroscopy systems. My purpose is to encourage, especially young generation, to go beyond the research. Yesterday, I have seen many researches. It is excellent. It has a great possibility. You can make a great reality. With Rowan, we are doing that too. Surgical trend is minimizing incisions from open surgery to multiple surgery, single port surgery, even non-invasive surgery. It's a trend. So we are the robotists. We can agree, robot has changed the paradigm of laparoscope surgery due to intuitive surgical. What are the real advantages of robotic surgery in addition to wrist joint? I think it's ergonomic postures. Okay? And then 3D visions, scaling of motions, stable positioning. That is a robotic technology. But unfortunately, we don't have any AI yet. Endoscope, look at that. This medical doctors are still using very strange interface. I think we should help them with the robot technologies. This is my belief. Era of robotic endoscope surgery is coming, like Da Vinci. Left side is existing laparoscope robotic surgery market. It's very successful. How about endoscopic surgery robot market? It didn't exist yet, but it's starting. We are one of them. I have researched medical robot for 27 years at KAIST. I made many tries, but not was commercialized yet. So we made a startup company, Rowan Surgical. I made the Rowan Surgical name is Robotic Endoscopy. But my staff, my members interprets robot enables all kinds of surgery. It can be all our dream too. Among all those research outputs, we have thought about deeply what was the first commercial product. So we targeted kidney stone surgery. Is there anybody who has experienced kidney stone problems? It's very painful. 10% of population may suffer at least once. So retrograde intrarenal surgery, RIRS, is most popular surgical methods in neurology area. But do you see, this is actual surgery scenes. One medical doctor is operating scope, one medical doctor is operating basket and lasers. It's not so easy. It is good for patients, but very difficult for medical doctors. They have a muscle fatigue, and then multi-person cooperation, radiation exposure, of course, is very harmful. And then sometimes it's very difficult to estimate stone size, and then kidney is moving. Patient's organ is moving because of respirations. So we introduced Germanics, robotic systems. He was a postdoc in my lab, and then he became the head of the clinical research team. We can provide very precise ureteroscope motions. It may be the first surgical robot system that has equipped with AI technology. Yeah, someone may ask, what is AI? But we are using many big data to control respiratory motion compensations. So we can stabilize. Scope is moving together. So we can provide very precise laserings. It will be very efficient. Even though stone is moving, we can follow. And then we can remotely grasp the stones and then take it out. When we take the stone, we measure the stone size with the AI technology too. And when we need to go back and forth, we can provide us automatic reinsertion and the retractions. In this system, I believe there are 4 core technologies from the robotic side. One is, of course, ergonomic master console. Second one is respiratory motion compensation by AI technology. So we enhance surgeons' skills. That provides better outcome for patients. And then we measured stone size. So we guarantee safe operation. If surgeon is going to take out big stone, we may have a problem with ureters. And then this is automatic navigations. We provide a partial navigation. If surgeon is going in some place once, we memorize all the paths and optimize the paths. So at the second motions, we automatically go back and forth. He doesn't do, right? But scope is being navigated. We think Germanics will open the era of robotic RIRS surgery because it is ergonomic, versatile, efficient, and it gives a benefit to patients. Recently, 2 years ago, we all finished the animal test and the clinical trial. So we have got approval. This is really launched to the market. So 10 cases of pilot clinical surgery has been conducted in Samsung Seoul hospitals. Okay. Do you see? This stone is moving one, but we stabilize it. He could cut with the laser like a paintings. This is the art of robotic technology. This is me. So I really praised his great skill. I assist with robots. He told us, Germanics will change the paradigm of kidney stone surgery, benefiting the patients. That is really what I really wanted to hear from the medical doctors. I got it. I investigated his 10 cases results. He could cut from 5 millimeter size stone to up to 5 centimeters. This is a kind of history in surgery. He wrote the history every surgery. What I mean is, the surgical way of kidney stone is usually 3 ways: ultra shock wave, and then using the endoscope RIRS, and the PCNR opens the hole to the kidney and take out the big stones. So according to the stone size, they select a surgical method. Currently, ESWL, RIS, PCNR. RIS is the most popular surgery. But with our robot system, we will create a new surgical method, robotic RIS, in this way, that we are envisioning. However, in commercialization of medical device, more process has to be resolved. We talked about mostly some robot design and controls. And I also talked about clinical trials. But there's much more. Intellectual property issues, risk management, manufacturing, usability tests, regulatory support. There are so many things. It's very difficult, but we can go through together. Regulatory certification is a really big hurdle, but we can go. We have gone through all the tests, IEC, ISO tests, and GMP tests, ISO 13485 regulations, and then we also got MFDS approval. It's a Korean FDA. Medical device has to have overcome one more. Even though we have got approval for as a medical device, we need to get the reimbursement code. So hospital can charge to the patients. We have got through. Geminix, will connect to additional devices, including laser, imaging device. And then we will extend the surgical applications from ureteroscopy to ERCP, gastrointestinal surgery, or bronchoscopy, cardiovascular surgeries. Real challenge for the commercialization is having the good people. Your friends, your professors, colleagues, students is a really important asset for you.
Dong-soo.
Thank you very much. I hope everybody you can add your dream to our dream and then become true. Thank you very much.
Thank you. Thank you, Dong-soo.